Thank you, Joe. Let me just say, with regard to Sean's presentation, the only thing better than having that blissful moment of discovery is having somebody to share that blissful moment with. And it's been great to have a scientific partner for 40-some-odd years. So, a false dichotomy plagues American medical schools. The dichotomy states that basic scientists make discoveries and physicians apply discoveries to patients. This year's Lasker Awards expose the fallacy of this dichotomy. The basic award goes to 3 physicians, and the clinical award goes to 3 basic scientists. The physicians discovered a fundamental property of nature, and the basic scientists translated discoveries into a cure for a fatal liver disease. The basic award recognizes 3 physicians who discovered the universal mechanism by which animals respond to a deficiency of oxygen. The 3 doctors are Greg Semenza of Johns Hopkins, Peter Ratcliffe of Oxford, and William Kaelin of Harvard. Our cells use oxygen much like a fireplace does. Oxygen combines with carbon to release energy. Cells cannot store oxygen. They require a constant supply. When deprived of oxygen, brain cells and heart cells die within minutes. The result is a stroke or a heart attack. The body needs to sense oxygen deficiency and to correct it. Oxygen is carried by red blood cells. If red blood cells are deficient, oxygen transport fails and cells die. So animals evolved a system to detect oxygen deficiency and to increase red blood cell production. The sensor is located in the kidney. When deprived of oxygen, the kidney secretes a protein called EPO that travels to the bone marrow, where it stimulates production of new red blood cells. EPO was purified in 1977 by the late Eugene Goldwasser. It took him 15 years. With the protein sequence in hand, the gene was cloned in 6 months. The fundamental question was exposed. How do kidney cells activate the APO gene in response to oxygen deficiency? This is not a simple problem. Oxygen is a gas. How do cells measure a gas? And how do they use this information to activate a gene? Mother Nature is a striptease artist. She reveals herself in stages. To expose her beauty, scientists must remove layer after layer. Greg Semenza removed Mother Nature's coat. In the early 90s, he guessed that the EPO gene works like other genes. There must be a protein that activates it. The protein must bind to a piece of DNA near the gene called an enhancer. Semenza identified the enhancer. He used the enhancer as bait to purify the transcription factor, and he named it hypoxia-inducible factor, or HIF. He found that the amount of HIF increases when cells are deprived of oxygen. HIF enters the nucleus, where it activates the EPO gene. So Mother Nature's coat was gone. Next came her dress. The riddle was, how does oxygen deprivation increase HIF? This is where our other 2 winners came in. Working almost in tandem, Ratcliffe and Kaelin identified the protein that regulates HIF. The protein has a hybrid German-Swedish name, von Hippel-Lindau. We call it VHL. VHL is a HIF executioner. It binds to HIF and destroys it. When VHL is active, each HIF molecule lives only a few minutes, far too short to activate the EPO gene. Somehow, a deficiency of oxygen must silence VHL so that HIF can survive long enough to enter the nucleus. The discovery of VHL removed Mother Nature's dress. The end was near. But first, Doctors Ratcliffe and Kaelin had to figure out how oxygen inactivates VHL. The key is the way in which VHL recognizes HIF. VHL binds to amino acids on HIF that have oxygen atoms attached to them. If these amino acids lack oxygen, VHL can't destroy HIF, and HIF will live to activate EPO. What attaches oxygen to HIF? There must be an enzyme. The race to find the enzyme was on. 3 teams crossed the finish line at once. They were led by Kalin, Ratcliffe, and a late entry into the game, Steve McKnight of UT Southwestern in Dallas. Forgive the plug. The enzymes are called dioxygenases. They latch onto oxygen and transfer it to HIF. Oxygen-coated HIF is recognized by VHL and destroyed. When oxygen levels are low, the dioxygenases have nothing to transfer. HIF lacks oxygen, and it escapes VHL. HIF enters the nucleus and activates the EPO gene. At last, the problem was solved. Mother Nature's beauty was revealed. All great striptease artists save a pleasant surprise for the end, and Mother Nature is no exception. The surprise is a cure for cancer. The search for an oxygen sensor began as a quest for an activator of the EPO gene. Nature's surprise was that HIF activates much more than EPO. It activates 200 other genes. Moreover, HIF is not confined to the kidney. HIF is found in all cells. What other genes does HIF activate? Some of them increase oxygen delivery by stimulating growth of blood vessels. HIF is essential for cancers that need new blood vessels to support growth. HIF also activates genes called cyclins that cause cancer cells to grow. High levels of HIF can be tragic. Rare people inherit mutations in VHL. Without VHL, their cells can't destroy HIF. Unrestrained HIF induces tumors in the eye, in the nervous system, and in the kidney. Even when people don't inherit mutations in VHL, their kidney cells can acquire mutations, and the elevated HIF drives tumor formation. Recently, a biotech company has invented an inhibitor of HIF, and it shows early promise in the treatment of patients with kidney cancer. My striptease analogy is not perfect. Striptease artists remove their own clothes. Mother Nature needs help. Passionate scientists must fumble with the buttons, zippers, and hooks. Doctors Semenza, Ratliff, and Kalin did not fumble. Guided by brilliant intuition and powered by delicate technology, they deftly removed each layer. I can only imagine their delight as each discovery moved them closer to the ultimate answer. These 3 doctors exposed the beauty of Mother Nature, and they clearly deserve the Albert and Mary Lasker Basic Science Award.